Welcome back to the channel. Today, we're diving into a crucial topic for men's health, the causes of prostatitis. As a doctor, I see a lot of guys hesitant to talk about these things, but trust me, it's super common and nothing to be ashamed of. We're going to break down the different types of prostatitis, what causes them, and what you can do about it. Because knowledge is power, right? By understanding the potential culprits behind this condition, we can take proactive steps towards prevention and treatment. So let's get right into it. First up, we have bacterial prostatitis. This type is pretty straightforward. It happens when bacteria, those tiny little troublemakers, manage to sneak their way into the prostate. Think of your urinary tract like a pathway. Sometimes, bacteria from the bladder or urethra can travel up this pathway and end up setting up camp in the prostate, causing inflammation and a whole lot of discomfort. Now, when we're talking about bacterial prostatitis, it can be acute, meaning it comes on suddenly and severely, or chronic, which means it hangs around for a longer period of time. Symptoms you might experience include pain in the pelvic area, burning during urination, frequent urges to pee, especially at night, and sometimes even flu-like symptoms like fever and chills. The good news is, bacterial prostatitis is usually treatable with antibiotics. Your doctor will determine the best course of action based on your specific situation. Now let's talk about the most common type of prostatitis, non-bacterial prostatitis, also known as chronic pelvic pain syndrome or CPPS. This one's a bit trickier because the exact cause is often unclear. Unlike bacterial prostatitis, we're not dealing with an infection here. Instead, CPPS is thought to be triggered by things like muscle tension in the pelvic floor, nerve problems, or inflammation without the presence of bacteria. Imagine your pelvic floor muscles like a tightly wound spring. If they're constantly tense, it can lead to pain and pressure in the prostate area. Similarly, nerve issues in the region can send those pain signals firing. Symptoms of CPPS can be quite similar to the bacterial type, including pain, urinary problems, and even sexual dysfunction. However, because there's no infection involved, treatment typically focuses on managing symptoms. This might include things like physical therapy to relax those pelvic floor muscles, medications to address pain and inflammation, and lifestyle changes to reduce stress and promote overall prostate health. In some cases, prostatitis can be linked to autoimmune issues or problems with the nerves in the pelvic region. Let's start with autoimmune prostatitis. Our immune system is like our body's defense team, fighting off harmful invaders like bacteria and viruses. But sometimes it can get a little confused and start attacking healthy tissues, mistaking them for enemies. When this happens in the prostate, it can lead to inflammation and pain, similar to other forms of prostatitis. Treatment for autoimmune prostatitis typically involves medications to suppress the immune system and reduce inflammation. Now let's talk about nerves. The prostate and surrounding areas are full of nerves that play a role in everything from bladder control to sexual function. If these nerves are damaged or irritated, it can definitely contribute to prostatitis symptoms. Nerve problems can arise from various factors, including surgery, injury, or even conditions like diabetes. Managing nerve-related prostatitis often involves addressing the underlying cause and exploring pain management options. Believe it or not, prostatitis symptoms can stem from urinary tract issues. The prostate and urinary tract are neighbors, so problems in one can affect the other. Residual urine can breed bacteria, leading to infection and inflammation. Blockages or narrowing of the urethra can also contribute to prostatitis. Addressing urinary tract problems is crucial. Your doctor can recommend the best treatment, whether medication, lifestyle changes, or a minor procedure. Both excessive sexual activity and prolonged abstinence can contribute to prostatitis symptoms. Excessive ejaculation can strain and inflame the prostate. Prolonged abstinence can cause swelling and irritation. The key is balance. A healthy sexual rhythm can prevent prostate irritation. So there you have it, a breakdown of some of the most common causes of prostatitis. Remember, this condition is more common than you think, and there's absolutely no shame in seeking help. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips. And remember, if you're experiencing symptoms of prostatitis, consult a healthcare professional for proper diagnosis and treatment. Early detection and treatment are key to managing symptoms and maintaining a healthy prostate. Take care of yourselves, and I'll see you next time.